So again, after you mentioned the first component, the emotional part, we do think that as healthcare providers, we want to look into do you have any depression? Do you have any problems with stress, anxiety? And you said you didn't talk specifically about it with your primary care doctor, but this is also very a big part of what we do. So I like to talk about this also at the beginning of the program.
Okay.
A lot of the times we kind of select some medication that also helps us, because a lot of folks also tell me that, okay, I started a depression medicine and I gained weight with it, or the opposite, or some folks are, what does this have to do with that? Or but the thought and the experience that we have right now is that certain medications really do help, especially, for example, Prozac. I use it very, very frequently. It does help folks with any pattern of not necessarily major depression, but it could help with anxiety, with depression, with folks that have a little bit of polycystic ovary patterns. We use that. Folks that maybe are adjusting to certain changes in life and times. There's a second medicine that I use also very frequently. It's called Wellbutrin. Wellbutrin or Bupropion. This medicine actually is a medicine that was designed originally as a depression medicine, but we also use it for conditions like seasonal affective disorder, which is common. We also use it for smoking cessation because of the craving. And the craving element, I think, is also something that we are learning more and more about this medicine. It's actually now approved. This Wellbutrin is actually approved in a weight loss pill called Contrave. Maybe because of that factor, maybe because also something else, but the craving, if we can actually fix that. But that is a different story. I'll tell you more about that medicine if we choose.